so much of that depends on us all doing our part to keep this from going explosively, like we've seen in other places. But even if we were, and this is what the planning has focused on, even if we were in a situation like what we've seen in Italy right now, we feel that the planning that's being done should allow us to adequately care for everybody who needs it in those scenarios. It does mean that we would be, as things progressed and as we watch the trajectory, and that's where the modeling informs the planning, we would be able to cascade and increase the number of critical care beds that are available, hospital beds that are available, and we have plans for people to be able to, obviously it's critically important that we have the human resources to staff those facilities, but we also have plans for, if we need it, to move people who don't have COVID-19 out of hospital into an alternative care facility, and there's been preparations in each of the health authorities to determine what that might look like. And there's a rationale for why we would move other people out of the hospital, not put people with COVID-19 in another facility. And that is because it is safest for all, both the healthcare workers and the healthcare sector, if we keep people together. So it means that in hospitals right now that are treating people both in ICU and in hospital with COVID-19, they're all in a separate area together. And staff who look after them don't look after other people in the hospital. It's not like we have people sprinkled throughout the hospital, because that is riskier. It means that there's a probability that transmission could happen in the facility. So hospitals have been working very diligently over the last few weeks to hive off areas where we can care effectively for people with COVID-19 and for everybody else who needs hospital care. And then people only work in one area or the other, so that we're not transmitting between people as well. So the important thing that we can do is expand the capacity in hospitals, in all of our hospitals, and move people who don't need as high level care or can be managed in an alternate facility by others in the community. So that's the big question. Are we going to be okay? We have put a lot of thought in this, and I think probably the most important thing is that we've engaged across the health sector. All of the unions have been involved, those people who are working in critical care, who are working in the hospital sector, who are working in BCEHS, infection control, our leadership in the health system have really put their minds to how can we be as prepared as we possibly can. So now we all have to do our part to make sure that we don't get to that point. And that's why it's so important, as I keep saying again and again, it's so important for us all to take these distancing measures seriously, because it is making a difference, and we need it to continue to make a difference for the next coming weeks to months.
Just to say that I think that this reflects the determination of both Dr. Henry, of our Deputy Minister, who people in the media heard from this morning, Stephen Brown, and the whole healthcare system. Our emergency response started, I believe the date was January 28th, so basically 2 months ago. And steps were taken at every stage. And the fact that this has come later to us than it has to Europe, and obviously it did in Hubei province in China, has given us some advantages in terms of preparation. So all of the health authorities have been working together for 2 months, and the work you see here reflects that. And all of the work done to identify the initial, mostly travel-related cases and breaking up links of transmission, all of that was important. And then all of the work that Dr. Henry and her team in public health across the province have been taking, and all of you have been taking, all have a positive effect. So what we're doing here and what we're presenting here is not what we expect to happen. There will be a BC epidemic here, a BC COVID-19 situation that will develop. But what we wanted to do is prepare should that situation be as bad as places such as Hubei and as Italy. And we've been preparing for months, and the work here reflects that. So if it gets serious, we are preparing the most serious possible scenario. We are preparing for that scenario regardless of whether it's the most likely scenario or not. And I think that's what people would expect us to do, and that's what the months of planning led by Dr. Henry and Mr. Brown and so many others, dozens, hundreds of people across the province will bring about. And again, as Dr. Henry has said, I just want to express our appreciation both in long-term care and acute care and public health across British Columbia, the work of workers in every area, of doctors, of nurses, of healthcare workers, and their representatives who have been extraordinary and are a key part of our team. We wish to again thank them very much.